But the first thing people don't understand is Medicare is not free. I know we pay into it our whole lives, but it is not free once you get there.
That is a great way to start. And yes, it is not obvious to people that Medicare is not free. And there are some costs that come with Medicare that for some people are unexpected. And I'd say one of the biggest complaints we hear from our clients are that their financial advisor, if they have one, or retirement advisor, didn't really make it clear to them how much Medicare could really cost if you want some sort of comprehensive coverage. So what we're going to go through first is, what does Medicare cost, and what are the variables that might affect that for different people? And to keep it as simple as possible, Medicare has a couple different pieces depending on which way you go about setting it up. But for that most comprehensive type of coverage that exists, if you want the best coverage that's out there for Medicare, your picture kind of looks like this. You've got original Medicare on one hand, and that actually has a monthly premium through the government of $164.90 a month as of now in 2023. That number can fluctuate year over year. But to keep it very simple, Medicare A and B has one cost associated with is the Part B premium of $164.90 a month. And that's the base premium for people making under a certain income threshold. If for any reason you make above these income thresholds that are set by the government, they might actually charge you more for that. But that's the first piece we want to focus on, is that Medicare has a cost that you pay directly to the government to have it, right? Now, in addition to that, people have other products that they add on to this to make that Medicare more comprehensive. On its own, if we're keeping things super rudimentary, Medicare only covers 80% of all of your healthcare benefits, and it has a lot of out-of-pocket costs, deductibles and excess charges and all sorts of variables to supplement that and make this comprehensive Medicare package where instead of being covered at 80% with some out-of-pockets, you're covered at 100% instead. That involves an extra premium as well. And depending on the state, that can vary. But if we give it an average, that might be an extra, say, $130 to $150 a month. So when we put the whole medical picture together, if we want to be covered at 100% with our medical coverage, you might be right around $300 a month to have Medicare. And that doesn't include prescription costs that come in addition to that. So if we're keeping things very simple, let's just say on the health side, we've got around $300 a month that you might pay for Medicare. And that's if your income is below those thresholds that the government sets. If your income is a little bit higher, that number could be increased.
And it's interesting you bring that up, because a thing a lot of people don't realize is it's not your income now they look at. It's actually your income 2 years prior. So a lot of people, before they go on Medicare when they turn 65, or maybe even due to disability, but most people could be in their peak working years. You know, they're 62, 63, they're at the end of their career, they're doing pretty well. All of a sudden they get hit with this bill for Medicare from the government, not even from us, that is $200, $300, $400, or $500 a month per person in their family. And it's just a ridiculous cost that can really make it hard to budget, and in some cases make it unaffordable or not the best option.
Correct. And that income-related adjustment, they call it, that they bring on if you are making above a certain income threshold 2 years prior, sometimes there are ways to negate that. You know, if you've just stopped work, or if you had a loss of a spouse, or some other major life-changing event, Social Security will let you file to try to remove that income-related adjustment. But for a lot of people who receive a pension, or they start drawing on their 401k as they retire, sometimes that's not possible. So as we kind of circle back to that number that we came up with, which at a base, Medicare could be around $300 a month in total, increased based on income. But what we got to think about is, what does that look like over a lifetime for a single individual? Because as we mentioned, a lot of people start to have these complaints that their financial advisor, retirement advisor never brought this number to their attention when planning, and it actually makes a huge difference. Because if we're looking at $300 a month, it's about $3,500 a year. And as you get older, some of those costs slightly tick up. So we're looking at anywhere from $300 a month, or $3,500, $3,600 a year, up to almost $500 a month in the later years, maybe towards the 80s, which could be $6,000 a year per person. So if we're looking at an average of $4,000 to $6,000 a year per person, look at that over a 20, 25, or 30-year lifespan from the time you turn 65. That's an astronomical number, right? If we're looking at maybe, I'd say $40,000, $50,000 over 10 years. If you live for 20 or 30 years, you could be looking at $120,000 to $150,000 over your lifetime that you're going to spend on Medicare premiums. And that's for a single individual. Imagine you were a couple. There's two of you. Maybe if it's $150,000 over a lifetime for one of you, now it's $150,000 a lifetime for the other member of the family. That could be $300,000 altogether. that seems like a pretty important number to tie into your financial plan when you think about this is what I've got to live off of for the next 30 years. Maybe that $150,000 to $300,000 should be in there somewhere. Surprisingly, people complain, I never heard anything about this.
Yeah, it's so funny to me that a retirement advisor is probably like, oh, we're going to make sure you can see Rome finally. We're going to make sure you can see your kids. But the most important thing is healthcare. This is the part of your life that statistically you're just going to need more healthcare. And if you're not able to pay those bills, it's going to wreck everything incredibly. But I think that can kind of segue into our next point, that even though the premiums can be high and it can be a burden on some people, if you're on original Medicare with a Medicare supplement like a Plan G or something like that, your out-of-pocket costs are much more manageable and actually very predictable, so it can make it easy for you to budget for things like surgeries, like things like that.
Correct. When you do it right, as we kind of built this picture of this $300 a month, that's basically, if we're keeping it very simple, that's all that you're going to put out. There is no ancillary cost for surgeries or hospital stays. You don't have to budget for that variability. But unfortunately, what does happen is you got to budget for the variability of the drugs, which we'll get into in a moment how that's actually going to be fixed, hopefully in a couple years, so there isn't as much variability there. But what I think is important is that we go into the one next piece that people